Good evening, good evening, good evening, and welcome to Couch Conversations with the Doctors, where health is wealth. What night is it tonight? It is Monday night, and Monday nights are time for Couch Conversations. We're going to go around and we're going to introduce our esteemed panel as we do each and every Monday night. And I'm going to start with who we know as Dr. 100. And that's the woman who keeps it real in these streets. And then, Maya, if you can continue to go around the board and introduce everybody else until I come back, it will be greatly appreciated. Dr. 100.
Hello, good evening, everybody. Thank you, Nikki. Thank you, Congressman Davis, for creating space where community can connect and learn. I'm honored to be here. I'm excited to connect, and I'm excited to learn. With that, Roy, I want to send it to you so you can introduce yourself to our community. We're so glad to have you.
Thank you. Good afternoon. Good evening, everyone. I'm Roy Walker. I currently serve as the Senior Vice President of Academic and Student Affairs at Malcolm X College. I've been at Malcolm X College for a little over 15 years now, and we have a plethora of healthcare training programs ranging from certificate programs to degree programs, going anywhere from one semester up to 2 years. So very happy to be here and engage in the discussion. And maybe I can popcorn it over to Dr. Graham.
Thank you. I'm a retired physician. I worked in the western suburbs of Chicago for 30 years. And after that, spent 2 years in the congressman's office. And it was an eye-opening experience. It's a real honor and pleasure to be here with my colleagues. I'm going to try and answer your questions as best I can.
And I'll jump in and introduce myself. I'm Dr. Tony Hampton. I am a family doctor who has some additional training in obesity, nutrition, and functional medicine. I work with Advocate Health on the south side of Chicago, and I tend to help patients think about lifestyle first before we use bridge therapy, which I consider medication. So hopefully they can eventually transition off medicines by using lifestyle. So it's really been a privilege to do that as a physician. And it's also a privilege to be in front of you guys to share similar messages as we kind of talk to the community about wellness and what they need to do to heal. So a pleasure to be here. Thank you for the opportunity.
Well, I thank you so very much, Dr. Hampton, who is really our Wolfgang Puck of weight loss and nutrition. That's who he is. He's that. I want to say hey to Audrey Jaycox, who is here with us. She says, good evening to everyone. Good evening, Audrey, and thank you for being here with us on this evening. I know I have been getting some messages about where is Dr. Mason. Well, I'm trying to help Dr. Mason get on. He's having a few technical difficulties, but he is coming. I've also gotten some message about where is the congressman. Well, you know it is the night before election. So he may pop in, but we may not see him tonight, but know that he is here with us in spirit. Want to say hey to Judge Miriam Jackson, who is here with us, and she's saying good evening to all. Right before we start on that, Dr. Maya, before we start our conversation, I'm going to pop off for a second, but I would like to know if you can actually give us a health advisory in reference to the fact that COVID is still real and the measles has shown its ugly head once again, and how we can be careful.
Sure. Okay. First thing Nikki said, COVID is still real. I've been having some patients come in, and we've been seeing a lot of COVID lately. When I say a lot, it's not to the extent that we saw it before, but definitely COVID is out there. So if you're so inclined, like I'm definitely inclined, when you're out and about, I've started to use my mask because I've just seen way too many people with it. You know, I want to remind people masks go over the nose, under the chin, and that's where, you know, that's the proper way to wear it. The other thing, we're washing hands and we're using physical distancing. Since the only one notable difference since the start of COVID is that if you suspect you have COVID, two things: there are tests in your local pharmacy. A lot of insurance companies will cover the cost. You have to connect and find out. Ask your pharmacist to look into that for you. And now there are medications that calm the course, let's say, of COVID should you have it. So, but the earlier you get in care and access to the medication, the better. That's number one. Measles, right? So The Center for Disease Control and Prevention issued a warning about the increase in measles outbreaks. Chicago and Illinois is one of the territories that had an increase in measles. We want to remind everybody that if you're like, oh man, what happened? Did I get the measles vaccine? Things like that. Measles vaccines are vaccines that come in something called MMR. So you might see that in your chart, MMR. That stands for measles, mumps, rubella. But you get it when you're 1 year old, roughly, and then you get your second dose when you're 4 years of age. If you only have one dose when you're 1, that's about 95% protective. 2 doses take you up to 97% protected. Now, measles is a virus that spreads by in the air, respiratory, and usually it can stay on surfaces about 2 hours. For 2 hours. So as you're out and about getting close to people, that's to be noted. Now, how often or when during the measles course can I spread measles to my loved ones, things like that? Well, the studies say 4 days before a rash and 4 days after, measles can be spread. Usually, if the normal course of measles will resolve with supportive measures. What does that mean? You get a fever, they treat the fever. You have shortness of breath, go to the ED. There's that. You have a rash, they treat the rash. Occasionally, if you have a compromised immune system or your immune system is a little low, and during pregnancy, you contact your provider because there are other things and other medicines that they can give if you either have or you come in contact with someone with the measles, right? The city of Chicago invited CDC here last week to look into the cases, and I've gotten a lot of questions about that, and my response to that has been, well, I would certainly want somebody to invite authorities in earlier, because a stitch in time saves 9. So there's a lot of uproar about the CDC being here, but definitely my question is, would we want them to wait and then call them on the other end? For me, it's a no. So I'm excited about the things we're doing to protect ourselves. If you qualify for the vaccine and you have not yet gotten it, go and get it. There are loved ones who cannot get the vaccine for various reasons. So vaccines not only protect you, but it protects your loved ones too. I have more to say, but I want to make about measles and herd immunity and all that stuff. But I want to step back and let my colleagues comment.
Well, Dr. Myers, just kind of thinking that weren't the majority of these cases in some of the people came in over the border, and these are unvaccinated people to begin with. Wasn't that the case? And therefore, from my perspective, it makes a lot of sense for the CDC to look into this and to study it, because this would be a new situation for them to learn about and give us advice about how to handle this in the future. Is that how you think about it?
Well, yeah, sort of. I want to mention that there are some cases of the measles that are not associated with people that have recently come to the United States. But I do want to draw attention to what herd immunity is. So thank you. Thank you for making the space for me to say it. Herd immunity, a lot of people think herd immunity means everybody else got it across Chicago, the vaccine. So therefore, I don't have to worry about it. What we saw in COVID is herd immunity actually works community by community. So in the case that you're talking about, Dr. Graham, if you have people in one space and the majority of them have not yet been vaccinated, so it can spread in that space. Now, I'm vaccinated against the measles. So what that means is if I come in contact with measles, right, then my body has already checked in on measles because I got the vaccine. The vaccine gives you a little piece that's not infectious, right? We talked about the difference between eating a chicken wing and a whole live chicken, right? The vaccine is just the chicken wing that's not, so your body is exposed to it. It builds up an army against it. So when I was 1 and 4, I got my vaccine. My body built up my army against it. If I go into the space that we're talking about and the measles tries to get me, my immune system is like, partner, not here, and it handles it on site. That does not mean I will not get it. It means my body's ready to take care of it quick, fast, in a hurry, and I have a more mild course. That's what vaccines do. So back to herd immunity. We have people in the space without the vaccine, and so the measles gets a chance to, for lack of a better word, do what it wants to do, which is spread from person to person. That's why getting vaccinated is so important, right? So herd immunity does not mean, I live on the south side of Chicago, south side. Herd immunity does not mean because people on the north side, because people on the west side, because people across the border in Indiana got the vaccine, therefore I don't need to get it. It is my responsibility to check in with myself and my family, the people that live with me, to make sure we have the herd immunity. We have enough people vaccinated in my immediate surroundings, in my community, in my neighborhood, in my house, so that our bodies can do what our bodies need to do if measles tries to come for us.
And before we definitely want to, in fact, Dr. Miller, before I comment, would you introduce yourself real quick since you were just signing in, and make sure you unmute yourself.
Good evening, everybody. I'm Dr. James Miller. I'm a retired internist, retired in 2019. Don't do clinical medicine anymore, but still am interested in healing the community. And as I tune in, we're talking about a problem that is in the community. And as I was listening to Dr. Meyer's explanation of how herd immunity work is so exactly right. The virus is looking for opportunities and places where it can land. And the least number of places, the less likelihood that it'll be able to survive and to infect other people. And that's part of what herd immunity does, is decrease the number of available hosts for it to camp out in and to survive. So, yeah, that was as she was explaining that was an idea and the thing that came to my thinking in terms of how we have to approach it, and how at least the general public can probably think about it in terms of why we all have to do what we can, and that what we can is to, if we can be immune against that virus, then we are not a host for it. Therefore, it can't live there. So it either dies or it has to go someplace else.
Yeah, and I just want to reframe our understanding of why vaccines are so important, particularly for measles. And I just looked up, before the vaccine, what was it like to have measles? So it says before the measles vaccination program started in 1963, which wasn't that long ago, which is shocking. I was born in 68. An estimated 3 to 4 million people got measles every single year in the United States. Of that number, there were about 400 to 500 who died, and 48,000 were hospitalized, and about 1,000 would develop encephalitis, which is an infection in the brain. So without the vaccine, the children in particular were at risk for becoming seriously ill or dying by simply being exposed to a vaccine. Now, a lot of times we forget, and again, going back to COVID, 98% of the people who died in advocate hospitals were unvaccinated. So it's always about risk benefit whenever you make decisions about. I know that Boeing's been in the news lately about their airlines, and every time I get on the plane, I have to think risk benefit, right? And so when I get on the plane, I'm thinking, not a lot of planes are falling out of the air, and we're praying that we rectify any issues that airline, the people who make the planes are making, or the airlines. But I tell you, I'm not sure there's a big controversy about the benefits of vaccines when you think about what life was like before we had them. So everything that we put in our body, whether it's penicillin, even the Viagra, for the shout out to all the guys on the panel, but even Viagra, that people they take this stuff without thinking about the side effects because they're thinking about the benefit, right? But everything that we consume, aspirin, Tylenol, all of those things that have become kind of staples, you don't even think twice about it. But they all have risks. They have literally pages of things that can happen that are not likely to happen, but could. So I think as we think about the measles kind of sneaking up on us for whatever reason, always remember that in most cases, the benefit outweigh any potential risk. So as you are thinking about your family and what you should do for your family, keep that in mind. So I'll pause with that. I know we have a guest today, Roy Walker. So I want him to kind of
But we're gonna come to Roy in a second, because
cool.
Roy can't comment on the measles. So, and I know we've got a ton of questions about the measles. So I want us to get the measles thing out the way really quickly. And then we're going to let Roy take it away with Dr. Mason. I want to say hey to Connie Taylor, who is here. Connie Taylor has checked in, and Connie says, good evening to everyone. Keenan Keen says, I was at several events this weekend and without my mask, and I wasn't thinking. Now I'm nervous. Oh, Keenan, don't be nervous. If you've been vaccinated, let's just stay prayerful. I think you may be okay. Dorothy Murray is here, and she says, good evening to everyone. Sandell Scott is here, and she says, hello. Beverly Ivy is here, and she says, hello. Linda Johnson is here, and she's saying, good evening, everyone. Jack Orloff, hey, Jack, got your message. Jack Orloff is here, and he says, good evening to everyone just as well. So, Maya, have we updated people on the measles and what we need to do? Barbara Ivy is here. She says, I want to ask if mental instability has anything to do with the violence happening in our society. Well, Barbara, I want to hold on to that question for a second, because I know Roy Walker and Dr. Mason is going to tap into that for you in just a little while. Miss Deborah Coleman from Coleman's Barbecue is here. Can I get a large tip, Deb? That's all I'm going to ask. Can I get a large tip? Deborah is here. She says, good evening to everybody. All right, Maya, have we covered everything that we kind of needed to cover about those measles? Can we actually share if adults need to be vaccinated with an updated vaccine, how they can retrieve those? Can you share that for me just as well?
Oh, Doc, you're muted. Dr. Maya, you're still muted.
You get your measles vaccine when you're 1 year of age and 4 years of age. You will know if you are in need of that by, I believe, people still, if you got your vaccines in Illinois, you still have access, because of the things that were changed during COVID, to your vaccine record, Illinois, under Illinois idphillinois.gov. You will, if you don't see it, check with your healthcare provider that you trust. You go to your healthcare provider you trust, tell them, I don't know if I got vaccinated. They can also check in their records. If they don't see it in your records, we draw a blood test to tell if, remember that army we talked about? We draw a blood test to see if you got that army. If you was vaccinated, the army's ready, we draw that blood test, and then we can tell you whether or not, follow up on whether or not we recommend that you get it, right? Everybody can't get it. So, but you have to talk to your healthcare provider in order to determine that. I think that's it. You're contagious 4 days before and 4 days after the rash. Measles typically, feel like rash, fever, some white spots on the inside of your cheek called copelet. Look it up with a K if you want, copelet spots. And then occasionally, measles goes for usually people that are younger, some people that are older, but usually people that are younger. Measles has the risk of getting so bad, it really causes damage to your lungs and the rest of your body. Very rarely do people end up in the hospital because of measles, but there are some that do. We don't want to know if that's in our community, because remember what happened with COVID, you know what happened with diabetes, you know what happened with hypertension. Pick one. Our community bears the brunt usually, so there's no need for us to wait. We can think about the herd immunity lesson that we talked about today and make sure we're protected and our tribe is protected. I think that's it, Nikki, unless I missed something, team.
Yeah, and I'll just add communities of color, as you've just suggested, Dr. Maya, are communities that tend to be at higher risk for anything. So we have enough going on with uncontrolled diabetes, with the obesity epidemic, with uncontrolled blood pressure. And when it comes to metabolic health, which is, looking at your blood pressure, your blood sugars, your triglycerides, your good cholesterol, HDL, and your belly fat, only 7% of Americans are metabolically healthy, where they have all of those things being normal. Therefore, in communities of color, I think the obesity rate in the country is around 48% or so, but in communities of color, that number is way higher. And when you start to look at all of these risk factors, you then realize that the last thing you need is another thing. And people who get sick from any of these types of infections are people who are more vulnerable. So I would love to, I don't even want to get a cold, let alone anything else. So I think it's important that you continue to take care of your health. Spring's here, everybody's motivated to do better. But just be thoughtful that if there's something out there that's not traditionally out there, let's be cautious. I don't really wear a mask every day like I did previously. I'm kind of picking and choosing my spots. But with these things coming back, it makes you want to be more cautious. So just be thoughtful, understand who you're around. If you know you got some folk in the family that's ill, maybe that's not the best time to gather. Let's be respectful of each other. And if you're not feeling yourself or if something's going on, kind of isolate, keep yourself away, heal yourself, and then get around others. But the main message is vaccines are wonderful to prevent things that we don't necessarily have to have because we have access to this great technology. So Nikki may be still hiding, missing it. There she is.
I am still hiding. Well, Queenie Lennox is here. She says, "Good evening and thank you for your concerns about the community." Thank you so much, Queenie. Barbara Ivy also says, "Are measles vaccines good for monkeypox? I recently learned that a 10-year-old got monkeypox from school in Philadelphia, Mississippi." Oh, okay. Well, is the measles vaccine good for monkeypox?
Okay, so no, it's not the same vaccine. Measles comes with the MMR. Monkeypox is a different vaccine, and they're spread different ways. Like measles is spread in a respiratory fashion. Monkeypox is spread from skin to skin. So out there, when someone says someone got monkeypox from a daycare, we know that our kids touch their faces, touch each other, touch our faces, things like that. This, really underscores as monkeypox, we're starting to look at it and how it spreads. It underscores how a stigma or labeling of something can make us miss it entirely, miss the opportunity to care. Care for our communities. Monkeypox is spread skin to skin. So if I have monkeypox on my hand and I touch my face, it's spread like that. If I have monkeypox on this hand and I touch this hand, it's spread like that, skin to skin, no matter where it is on the body. Keep that in mind, and don't let things like stigma and labeling and things like that make you miss your opportunity to do what we need to do for your tribe. Does anyone else have anything?
I'd just like to add that, Dr. Maya, that each of these vaccinations is specific for a specific problem. Like you talked about MMR. Well, I think the German measles is also a part of the MMR. There's measles and rubella. So there's one for measles, one for German measles, one for shingles, one for flu. So they're very, very specific. One doesn't give you protection against the other. So you get one for each of the problems. So I'd just like to add that.
Okay, well, I think we've answered our measles questions. Well, Barbara says, Dr. Maya, is there a vaccine for monkeypox? Well, yes, there is, but Maya, can you share the monkeypox vaccine?
Yes, there is a vaccine for monkeypox, and thank you, Nikki. It reminded me that I did not answer one of your questions. You can go to shyvax.gov or City of Chicago or call 311 if you want to find out where you can get the monkeypox vaccine, where you can get the measles vaccine, where you can get the COVID vaccine. If you don't already have a healthcare provider that you trust. If you have a healthcare provider you trust, contact them, and usually they have the ways that you can get the vaccine that populates to their system so your healthcare provider can tie your healthcare up neat with a bow that they can further assist you in.
And you can also contact the Cook County Department of Public Health if you live outside of the Chicagoland limits. And you can also contact IDPH, the Illinois Department of Public Health. Before the end of this program, I will make sure that I upload those links in there for you if you need that, so you can actually contact them as well. But know that you can also reach out to any of our providers throughout the Illinois 7th Congressional District, and especially inside of the Illinois Medical District. Know that they are all there and provided for you. And you can go to any of our FQHCs, which are federally qualified healthcare centers. Well, Dr. Mason and I have had a time trying to get his technical stuff together, and he has had such a problem until I believe his computer may have died. But he is here with us. You won't be able to see his face, but he is here with us verbally. We'll be able to hear his voice. So, Dr. Mason, if you can introduce yourself for us, please.
Yes, well, good evening, and sorry for the technical delays. The StreamYard guys are not working favorably with me tonight, but I'm grateful to be here. And Roy, it's always good to be sharing the stage with you. I haven't talked to you for a while, but we go way back, Roy and I. And it's good to see and hear all the other folks on the panel.
Outstanding, outstanding. Well, there was something tonight. There was a word that was tossed around tonight that I really loved. And that word that was tossed around tonight was options and availability. Let's talk about that, Roy. There are tons of options and availabilities at our city colleges.
Yeah, that's right. And good evening, everyone, and thank you all for having me on. So there are quite a few options and availability at city colleges. Unfortunately, I find that most of our community aren't readily aware of them. First and foremost, we have programs that range from certificate to degree offerings in healthcare, many of which, if people had known about a long time ago, they might have made their first option considering the amount of time they would have saved, the amount of money they may have saved, and the rewarding career. We have some careers that will start you out at $70,000, $80,000 a year. Interesting enough, that's a lot more than you can get some of your 4-year degrees. But I want to touch on something else that was mentioned earlier regarding mental health and some of the initiatives that we're having at the college. And that was some of our minority young Black men in healthcare and in academia, for that matter. Many of them don't necessarily know how to be successful in school and post-secondary education. And we've had some challenges, whereas we were not having as many of our young Black men enroll the way we would like to have them have. However, because of the work of Congressman Danny Davis and the support that he's provided us, he's given us much more awareness right now where we'll be able to have a change in a positive direction where now we've seen more Black men come to us at our college, really to participate in what is known as our EMT paramedic program. And so for those who don't know, EMT paramedic is a very, very rewarding career. Usually it has a foray into the Chicago Fire Department, which historically we know has not necessarily had a lot of African Americans be employed there. Well, through this program, partnering with the Black Fire Brigade, we've been able to have a lot of success now where we're teaching young men how to save lives. And not my mantra, but that of none other than Quentin Curtis of the Black Fire Brigade. If you teach a man how to save a life, he's less likely to take a life. And so we're looking at this as a real sincere effort to try to make sure that our Black youth have a place and home at Malcolm X College to really be able to explore their dreams and really reach their unyielded potential. So I'm just excited to be able to share this platform with all of you all, just to kind of speak around some of the great things that our college is doing. We're doing a lot more wonderful and awesome things, but we realize that sense of belonging is what's been missing the most out of our young Black men. And we've been giving power to their voices to really get them to understand that you have a home here at Malcolm X College, and we really are here for you. And we were able to bring some of our young men coming out of high school and off the street and a forum for a focus group. And some of the stories that we heard was just really, really astounding. And not necessarily always in a good way, but just to understand like what they've had to see and what they've had to endure at a very young age in life really kind of makes you realize that some of these young men just need help and need to have a sense of belonging and other people care about them. And so we are here to do just that. And it's not just at the administration level, but all the way through the organization, from our staff, our advisors, and our faculty in particular. So I just wanted to kind of talk about that really quickly and be willing to answer any more questions that you all may have as far as what's going on at the college. I didn't talk about a lot of the good stuff, but
yeah, Malcolm X has a plethora of programming, not just the EMT. I want to share that there's something called an EMR just as well. EMR is an emergency response driver. They teach you how to do this specialized driving to drive the ambulance. And then if you want to move on and join the EMT program, you can. So that's something that you can look at just as well. Also, there's dental hygienist that's there. There's a nursing program that's there. And guess what, Roy? You may be getting a new student by the name of Terry Mason in your mortuary science department. Dr. Mason is thinking about stopping at Malcolm X since he is retired and taking up mortuary science. Isn't that correct, Dr. Mason?
That was a thought. That was a thought at one time. Because there are a number of reasons for it, but it is a profession that is that we have, Black folks have still remained a significant presence in. And there's a lot that we do and what that is done. Like I'm talking already, that they do in that profession. And so, Roy, I think that particularly as we look at workforces in some of these areas getting older, we need to be thinking about how we replenish folks as they choose to move on.
No,
go right ahead.
I'm also no, you're absolutely right. And Nikki, you touched on a few programs, but we kind of have to pride ourselves in saying that we carry every program from the cradle to the grave, and that's where mortuary science ends it all. And Dr. Mason, we'd love to have you. I'm still waiting for you to come in and get registered. You would definitely be a highlight, but we wouldn't treat you any differently, though. You would have to earn your way just like anybody else. But needless to say, you're right, Nikki. We have quite a few. And dental hygiene, we have community healthcare worker. I heard a little bit earlier today with the doctor talking about the measles vaccine and how there's vaccine hesitancy from our community. We created a community health worker program to kind of help address that, so that there's someone that can help bridge the gap between the healthcare provider as well as the patient, because of some mysticism or mystique around just being afraid of taking their medication and doing what the doctor tells you to do. We created a mammography program for our radiography technicians. We have patient care technician, phlebotomy, sterile processing technician. I mentioned respiratory care already, surgical technology. So the numbers go on, and we're exploring even more programs right now to even branch out to other parts of healthcare, including computer tomography, CT, as well as a medical lab technician. So, Malcolm X is one of those entities where we're growing tremendously. We're growing rapidly. We just made an announcement that we're going to be partnering with our sister college, Kennedy King, in bringing the associate degree nursing program there as well in a few years. So understanding the demand that there is in healthcare and our opportunity to be able to serve a growing demand from our students and our healthcare providers is something that we're here to follow through with.
Well, I love the statement from the cradle to the grave, because there's also an early childhood development program that, if that's a focus that you're looking at within city colleges, that's there just as well. And then that grave is also talking about dignity, because there is dignity in your departure from this earth. And that's what we love about your mortuary science program. It teaches how you can have dignity and protect those bodies and sustain that life as that life has moved on or transitioned to its next place. Dr. Mason, you often say that the cavalry isn't coming. that we are the cavalry. That's something that you and Dr. Miller constantly talk about. Well, tell me about that cavalry.
Well, the thing is that the beautiful thing about a place like Malcolm X as it relates to the cavalry is that we got a place to train. We got a place to take the recruits and train the new cavalry in outstanding numbers. And there are all, and Mr. Walker just went through just a few of the programs over in the city colleges, but there are a number of opportunities that he's listed and maybe a few that not yet, that we should be taking advantage of, because I'm gonna tell you, if we don't, others will. And it's there for those who want to come in, put in the work and get it done. And so we should be making any excuses. So those of us that come out of some of the schools that may not have been the best and some of our primary and even some of our high schools, Mr. Walker, what kind of help do you offer some of those students that may be challenged a bit with math or reading or things of that nature as they try to go through the programs? Because they need to know that they can get some help.
So I'm glad you asked that question, because we actually have a lot of students that are coming varying levels of ability at our college. We're an open access institution, and so that means we have to serve students exactly where they are. So we have an adult education GED program. English for a second language is a very growing, burgeoning program, as you can imagine. And then any student that comes in, we kind of give them an assessment to kind of understand what level of reading and writing and math that they're in, so we can kind of be able to, identify where they can start and how long it might take for them to succeed. Some programs do not have a lot of barriers for entry. It makes it very readily easy for them to get access to, like patient care technician. We also have a number of grant programs that pay for all the costs to attend, including books, uniforms, tuition, you name it, through our WI Impact Grant, Project Impact Grant, as well as others that we have as well. So one thing in particular that I'm excited about, and Nikki, you honed in on the EMR program that we supported through the Congressman Danny Davis, is that program is actually going to feed right into our paramedic program. And so, once you start becoming an ambulance rider and a driver rather, once you take a few more science courses under your belt and testing the English level, college level English reading and writing, then you're able to start into our paramedic program, and you're going to be very, very successful once you get in. All of our programs are very high quality. We have about an 85 to 90% retention rate, and that coincides with also completion rates as well. So for us, it's a matter of access and getting in early. And right now we're creating ways in which we're trying to expand and grow, given the number of students that we have coming into our college with the number of coveted seats that we hold for each one of those. So that being said, we're expanding. We're working with partners to identify what new programs we need to offer, and we're excited about growing a little bit further in the South Side of Chicago. So now we're not just localized on the near West only.
Mr. Walker, could you also talk just a bit about the programs in fitness that you have in terms of training and things of that nature? It's something that you and I go back a ways about talking about. Can people learn to become exercise gurus at Trinity King as well?
Sure. And Doc, you speaking of our beginnings, my training, I'm a clinical exercise physiologist by training. So yes, my baby did create the personal fitness training program, and that's a foray into the physical therapist assistant program. And so we have a state-of-the-art gym with an AstroTurf, pneumatic resistance equipment. We really left no stone unturned as far as the resources that we provide to make sure that our students have the best in class, as far as not just technology and facilities, but also in our staffing. So many of our programs that we have offer are being taught by professionals who are working in the field, doctors, as well as some physicians, and certainly a lot of our DPN, doctoral nurse practitioners as well. So yes, we do have that program, Dr. Mason. And honestly, it's one of the programs that we're looking to start with our high school students through early college. One of the other opportunities that we try to give all of our students to give early access while they're in high school, because we recognize and realize that while you're in high school, you're not thinking about being a radiographer, you're not thinking about being a surgical technologist. Let's face it, the most popular programs, particularly in healthcare, are what you all represent. physicians and nurses. And so many of our students come out of high school wanting to become a doctor, but they just never even thought just for a moment about what it means to be a surgical technologist or medical assistant even. Um, and so these are actually opportunities that a lot of our students can start to go into medical school. In fact, we've had dozens of students that have come out of our paramedic program that have went on to become physicians. So we are a great starting point just to kind of get an understanding about what it means to be a healthcare professional and to get a little small sense of what it might mean to have to learn a little bit about anatomy and physiology to prepare yourself for medical school. And I don't want to speak too head of the game, but I'm actually have huge ambitions for us to be able to create a pathway for students to go directly into medical school as well, maybe through postgraduate process. But nevertheless, we know that there are a lot of access to being physicians comes through a postgraduate program, in which I think Malcolm X College might be one of those opportunities that we can seek a little bit further an investment on.
Well, I think you should speak that into existence. I think you should. I think you have the platform to do that, and I think you should speak that into existence. And then I think we could prepare to make sure that something like that could actually happen. You know, we have an inbox question that says, to Mr. Roy Walker, you mentioned some of your programs may have barriers to get in. What would those barriers be?
Well, first and foremost, sometimes when students actually have transcripts from going on to a four-year school and they still owe that school tuition, we can't readily admit that student to our program without having an official transcript in place. So sometimes that becomes a big problem because now a student may have started at a four-year institution, got stopped for whatever reason, either academically or financially. And needless to say, if they're not able to bring a transcript forward, then it's hard for them to kind of get started because we have a clearinghouse in which we have to, by our accreditation, have to make sure that we vet all of our students coming in to be able to readily understand their readiness to start college level. And the other fact of the matter is the federal government's not want to pay for English 101 twice, right? So the way you verify that that class was taken is through the transcript. So that's one small barrier. The other barriers that exist sometimes are when students come in with a lot of classes under their belt, or they may not have been very serious in school right away. So sometimes they may have to retake those prerequisites over again to get a fresh GPA established. And sometimes when you start with a really bad GPA, it's really hard to kind of pull it up. So we're investigating ways in which we can kind of level the playing field to make it a more fair process for those students, let's say, who weren't as serious in their youth, but they still kind of carry those transcripts with them. So sometimes there's a lot of explaining that has to happen for those students that may have some bad debt or some bad coursework under their belt that they have to be able to speak to. So those are some of the small barriers. Then, of course, there's also financial barrier, and then there's also a time barrier as well. All of our programs right now run at a full-time capacity, meaning that they are taking minimally 12 credit hours per semester, which almost equates to a full-time job when you factor in the amount of study time that is required for how many contact hours that you're enrolled in. And so that being said, some of our students that have to work during the daytime, it makes it a challenge if they're not well resourced to be able to take classes during the day to be able to attend with full participation. So some of our parents that or students that we know that prefer evening classes, some of our programs are available in evening, but not the totality of it. And that becomes a lot of a resource barrier for them. So those are the main three issues that we face with some of the barriers for students getting access to our programs.
We have another inbox question for you that says, is there an online study or online course option?
So some courses we do offer online, but unfortunately, some courses, particularly in our CTE programs, you can't learn how to do online. So, becoming a paramedic, you can't learn how to do that through an online format because there's a skill acquisition that you have to demonstrate competency in before we allow you to go into the workforce. And for that matter, even go through a clinical rotation. Some of our more perfunctory courses that we offer in our general education classes, yes, many of those classes are online. And our health information technology program is also online as well. So some are, but the vast majority of CT programs are not. But we do have online options for many of them.
Well, Carrie Steele is here with us, and she says good evening on today. And I want to say hey to President Steele. Hey, Carrie Steele, how are you? Carl Brinson is here with us. Carl says hello, Carl. Carl Ellis is here just as well. I want to say hey to Carl Ellis too. Thank you for tuning in on this evening. Question says, roughly how much is the cost of a credit hour? That's a good question.
So the cost right now is $146 per credit hour, and registration starts April 1st. So for summer and fall, so it's very affordable. Again, we have a lot of programs that will support students uh, financially if they decide to come and enroll at Malcolm X. But yes, they're $146 per credit hour right now, with a small increase of about $7 per credit hour to about $153 come the fall semester if they register at their time period in June.
And there's a rumor out here, well, it's really not a rumor, it's kind of true, but can't you leave a CPS school and come to a city college for free if you have a certain GPA?
Absolutely. So it's part of our Star Scholars program. If you have a 3.0 GPA, you can automatically enroll at city colleges and have your tuition and fees waived entirely. And many students do take advantage of that. We've got a lot of Star Scholarship students that have taken quite advantage of that and have moved on to either transfer to a four-year institution or enter some into our health career pathways. So absolutely, that is a program that we've had for a little bit of time now.
Well, thank you. Oh, go ahead. No, go ahead, Dr. Mason.
No, Mr. Walker, I just wanted to know because one of the very big programs that a long time ago that Malcolm X has, which was really a stellar program, was the physician assistant program. And I think Rush has a physician assistant program now. Do you know whether or not that program at Rush is still in existence, and or people are interested in becoming a physician assistant? And we can talk about that in the show, or you want to on our show, what that means and what kind of opportunity that they may avail themselves of.
Yep. So Rush is a great partner of ours. They do have a physician assistant program, as there's maybe one other, I think, in the city of Chicago. I think Northwestern has one also. But essentially, yes, you can start at Malcolm X College. We have a transfer agreement with Rush University where students can leave Malcolm X and enter into their Bachelor of Health Sciences program. And upon obtaining their bachelor's program, they can then move into their physician assistant program if selected. Essentially, we did have that program quite a long time ago, but essentially what happened is that the accrediting body for physician assistants had deemed that program now needs to be offered at a graduate level degree offering, which means that the conferring institution needs to confer that program at a doctoral level or master's level, and no longer an associate degree in science, which we used to have. So we did have that program. We had a very successful program. And right now, we've pretty much been able to support students that are entering into that pathway through our articulation agreement with Rush.
At some point, we should talk a little bit more about what a PA does, because can be very, very valuable. And having had hired PAs in my own practice, it's really, really a nice, if you're don't think you want to go the whole way just yet, the PA program is a great way to get yourself started. It's not a nurse. It's a totally different program.
Oh, no, you're absolutely right. And so those who have a little bit gun shy to maybe enter medical school, physician assistant is definitely a viable option for them to consider. It does allow them to kind of go into different specialties in healthcare as well. And they do have a lot of privileges beyond that of a nursing, where some of them might be manage a practice themselves. So you're absolutely right. That is one of another great options that I think our communities to think about, because again, readily understanding knowledge about all the opportunity in healthcare is something that I think is still not well understood.
Well, I just want to reiterate the fact that the average net cost of a credit hour at a four-year institution usually runs at an average about $612 per credit hour. And at most of your two-year institutions, that credit hour costs about $337. But at Malcolm X, that credit hour is running about $147 to $150. Am I correct, Roy? Is that the statement you made?
Correct.
I just wanted to read 147.
Yes, 147 right now.
Yeah, just what you ain't got to say right now. Just 147. No, I'm just joking. Just wanted to reiterate that because that's cheaper than a pair of Jordans. I just want to put that out there. It's cheaper than a pair of Jordans. To go on. Well, Maya understands. Dr. Maya understands what I'm talking about because she's a sneaker, a sneaker. What? How could I put it? She's
Sneakerhead.
I'm sorry. What is it?
A sneakerhead.
Well, well, yeah, a sneaker connoisseur. Yeah, that's what I want. Yeah. Yeah, she
Well,
has a whole
Cinderella
room.
always needs a glass slipper.
Get it, Cinderella. She has a whole room full of all different types of sneakers. So that's the place to go. Well, Dr. Miller, you've been looking like it was something you wanted to say
Yeah,
about
you
what
know
we were
what? Yeah,
talking about. Come on.
yeah, this just didn't know how to really connect this because I actually an interesting. I had a couple of interesting discussion over the past week. Really talking about the situation and problem that we're having with young black men in the community. Actually, Dr. Mason and I had a short conversation on last Monday about how to get young black men into the healthcare field, and he was saying, "Well, where's the garden? Where's the crop that we're going to get from?" And then later on in the week, I had this conversation with another group that was talking about dealing with the at-risk group of black males, which is that group between the ages of 14 and I guess 25 or so. And so, I've always been talking about prevention. And so if so what I'm saying is, as Roy's talking about the situation in terms of, I know he's looking to those that are in high school, finishing high school, and maybe those that have gone to college and decide that they need to come back for one reason or another. What I'm saying is that how can we somehow connect to that younger age group, not on a regular program basis, but an exposure, motivation, or mentoring program where we can begin to get them to see. Because otherwise, what I'm, when I'm talking to people, what I'm hearing is that that group that's in the fire, the fire just going to continue to get bigger. Because if we don't prevent these other kids that are younger from we don't do something with them when they get to be 14, they are going to be in that same age. They're going to be in that same situation. And we have to figure out a way how we can bring those things down and to offer and to expose them at an earlier age. Because by the time that you're 14, most young men in our community think that they're men now, that they're real men. And so what I'm saying is that this process of prevention and the process of changing the mindset and being able to as you're talking about programs and things that young men ought to be looking at, how do we bring that down and touch the younger age group so that when they get to be that age, they get to be the high school age, now they're beginning to think about something that is worthwhile, something that is a different pathway than the things that they've seen in front of them in the street.
Well, Dr. Miller, I think that is an awesome statement that you just made because that's one of the reasons why I wanted to make sure that Roy was here this evening with a program that we kind of have, and that's our Black Men in White Coats. So I really love the fact that we're having this conversation. There's something that we do with the Feinberg School of Medicine with Northwestern when we have our youth in white coats, but we are focused on sophomore, juniors, and seniors in high school. But, I want to get with Roy probably Thursday or Friday. So, Roy, look at your calendar. Let's carve out a little time and let's mirror that program on a younger basis. And let's grab a couple of our younger schools. And, Roy, I always, when Dr. Mason and Dr. Miller and Dr. Graham, they tell me all the time, well, Nikki, I'm retired. That really means nothing to me because I send them on assignments and jobs all the time. So, we don't employ them over at Malcolm X. You got some doctors here, and we're going to let's look at expanding our white coats program to our students, our younger students. Let's stimulate them. Let's stimulate, and we don't have to actually do it in necessarily a school setting. Our churches are the cornerstones of our communities. Let's get our youth departments and our churches together, and let's stimulate that mentoring program with them. Let's do a white coats in our churches. We have the nurses board at the church. Let's get that together and let's look at that from a real dynamic and let's begin to mentor there in our children's choir and our youth choirs. Let's mentor them there because, the congressman often says a child can't be what a child can't see. Let them see us here at work, and let's pull that mentoring that way. What do you think of that thought?
And Nikki, I say I love it. And not only that, let's bring them to the college and come do a tour to see for themselves right now. You know, one of the things that we constantly doing is trying to let the community come in and just see the building, see the facilities, meet the students, meet the faculty. Don't hear from me. Come see for yourself. When you come into that space, you really understand right now the warmth, the community, the feeling that you have coming into those doors. And right now, we're creating that same atmosphere at our Westside Learning Center campus. We create an atmosphere with everyone we spread in the South Side. And you're absolutely right. Early exposure is critical. And so now we're even trying to partner with some of our 8th grade and 9th grade students early on, just so they can even see what it means to be a student in the programs that we offer.
And you know, Roy, let's look just a little younger, because 3rd grade, 8 years old is our pipeline to prison. And that's one of the reasons why our food service on a national level is looking at younger kids, and they have these youth chefs that's getting them busy. So let's look at that just as well. And trust, when I tell you, Roy, we got some help. We got a number of these so-called retired people like Jack Lynch, who's here with us, and he's saying, great presentation. Good evening, team, who is the former vice president of Gift of Hope. He'll be more than happy to help out and do whatever you need to do. Audrey J. Cox is here, and she says, I love these conversations with the doctors and their guests. We must keep it going. You are absolutely right, Audrey. And she's a so-called, retired former elected official. So I just want you to know we got a lot of people here who's going to be willing to be a part of that team. But go ahead, Roy. I'm sorry.
Oh no, I know Jack, and Jack, well, so good to see you again in the virtual space. He said he was going to retire, but I see he's not going to retire, so we wanted to bring him back for sure. And I see Dr. Karen Scott is actually in the chat as well. She's actually staff and faculty at Malcolm X College. So I'm really excited that we're getting some notoriety. And Karen, you're absolutely right. Early exposure is essential. Nikki, we don't have a problem with 3rd graders. We can bring them in right away. Come on.
Go ahead on and tell us what Karen said. What did Karen write there?
Students should be exposed to careers in middle school. These occupations should be introduced to them. Many times the students only think that doctors and nurses are the only health professionals.
Yeah, so go ahead, Dr. Mason.
I have one more thing.
Go ahead.
Yeah, one of the things, and tomorrow I have a meeting with a group called CPAS, Creating Pathways for Academic Student Success. And that's the group that Eric Whitaker and Steve Martin, some other folks have put together. But we also want to make sure that we look at this in its totality. And unfortunately, a lot of our students are not coming out of schools, particularly some of the local schools, are prepared adequately for what they need to do. And that's why it was so important that some of this remediation is available at Kennedy King. And I'd just like to ask Roy, would you think that you do a fair amount of remediation? Because what we're finding is we have students that are coming out of the Chicago public school systems, and they've never seen calculus, or some of them not even seen algebra. So we really do need to make sure that we identify where those things are and where we have the resources to sort of deal with that. And I'll let Mr. Walker talk about what they see sometimes even at the junior college level.
I can't quote stats right now as far as how many students coming in are at remedial levels. But one thing I think is important for you to understand that our median age for our students is 28 years old. We don't necessarily have a lot of students coming right out of high school that enter into city colleges. You got to remember, we live in the city of Chicago, and for many parents, the goal and desire, and understandably so, is for their students to go away to a 4-year school, typically outside of Chicago. And you can understand why when you look at the challenges that we face, with not only the cost of living, but also some of the gun violence that pervades our community during that age time frame. So that being said, we have students that come in varying levels of ability. And yes, we still know that there were quite a few deficits that occurred during the pandemic. I mean, for an entire year, almost a year and a half, students were learning online at a time frame when most of the educators really did not understand how to teach online and do it very effectively. And so because of that, we did see quite a bit of remediation. of students that were coming in that weren't at a level that we anticipated them to be in. But we prepared them for that and have several initiatives in place in terms of how we're supporting them and really being able to scaffold and lattice the foundational level of math and reading that they need to have in order to be successful. So we got our work cut out for us, and then again we are confident that we're going to be able to achieve the task. A big goal of ours is to make sure that every student passes math and English in their first year of education on the first try. So that's a big goal for us. If they can pass those two hurdles in that first year, we know success is exponential and they're going to be along their way. And so really for us, it's not only just a matter of bringing them to us, but once they get in, making sure that they know that they're available of all the resources that we have. We have support from the Access Center that can give them a tutor or a note taker for them. We have mental health services to support our students for those mental health challenges that, let's face it, many of us are going through and still going through as a result of the pandemic. We have food insecurity, food pantry to support our students that are food insecure. Right now, we're trying to figure out a way to combat homelessness and home insecurity, because you'd be surprised, quite a large number of our students actually don't know necessarily where they're going to put their head and where they're going to sleep at night. And so when you look at Maslow's hierarchy of needs, food and shelter are the first and most important things that you're going to have. You can't learn if you don't have those two things first. And so our students all have the capability of learning. We know that for a fact. It's just make sure we can put enough programming and support service in place to take all those other issues that are clouding their mind, taking up bandwidth mentally for them to figure out how they're going to survive themselves, so they can be successful at Malcolm X College. And so that's why trying to figure out ways we can expand not only the number of programs, but also the number of services that we're offering to them, particularly in the area of home insecurity, is one of our biggest goals and high priorities for the next 5 years.
Outstanding. So this is going to be our last inbox question, but if you have any questions that you'd like to drop in our public chat, please drop those in really quickly before we start our Until Next Mondays. So the last inbox question: hi, Nikki, I'd like to stay anonymous, but I'd like to say hi to Deacon Miller. Okay, so that lets us know you know Dr. Miller over here. Her question is, how old is too old to go to college? Great question. Well,
I would say too old is when you decide that it's too old. As long as you feel that you want is something that you want, something that is worth there, you spending the time, then you're not too old.
Okay, outstanding. And Roy, there is no age limit to coming into Malcolm X. Am I correct?
I said a moment ago, our median age is 20 years of age, but we have students as old as 60 years old at the college. So there is no such thing as too old, in my opinion. Old is a mind state.
There you are, and they're handicap accessible. So if you're even older than that, and you're in a wheelchair or you got a cane, you got time. Go to class earlier so you won't be late if you're on a cane, and bring your wheelchair. It is open. It is open. So since there are no additional public chat questions, we're going to go around our board and do our Until Next Monday. Well, Doug, until next Monday, what do you want everybody to remember?
Well, I just want to say how impressive a resource this is, and that this really resonates with my experience, because I'm really interested in workforce development. And I can tell you, when I go to the hospital and I get an ultrasound, I ask the technologist, how'd you get interested? Where'd you get your education? When I go to the dentist, I get my teeth cleaned, do the same thing. So I know that this is a successful pathway. And I just want to give my kudos to Roy Walker and the program that he's got going. I'm very impressed.
Outstanding, outstanding. Well, Dr. Tony, you're Until Next Monday.
I was chatting a little bit before we got started about the economics of your education, and when I got out of school, owed a ton of money. I was blessed to have the Department of Public Health scholarship to help pay back the 200 plus thousands of dollars I spent to get to that point. But there are some people who hesitate to acquire a medical education or a law education, or to become any type of profession, nurse practitioner, physician's assistant, because they look at the dollars first. And so my plea to you is to not look at the dollars first. you have programs right in your community that can help you achieve your goal. I mentioned before we started that I got my real estate license, which was kind of something I did as a doctor helping investors, and I got it at Triton College. It was when I did my when I was in college and I wanted to save a few bucks, I went to Olive Harvey and got my calculus courses done. So this is a tremendous opportunity, and the programs that provide some coaching and support are very important. It's very manageable, and it's never too late. And I want to echo that. I'll wrap up with that comment because when I was at West Suburban Hospital in Oak Park in my family practice training, my Dr. Kathy Walsh was my medical director, and she actually didn't even go to medical school until her kids were done with college. She literally waited and was a great mom, did her mom thing, and then so it's never too late. If you are getting your degree at 65 or 70 and it's something you're passionate about and you're healthy and you're doing fine, nobody's going to ask you, when did you get your degree? They don't care. They just want you to be good at what you do. So don't have those barriers in those self-limiting beliefs keep you from doing things that are going to help you feed your family and or help you live your life purpose. So rather it's Dr. Terry Mason going back to get his training,
We
whatever
might
it
do
is.
it together.
We may have to do it together, whatever. So listen. Life is short, and what you don't want to do is get to the end of your life and have regrets. The 5 Regrets of the Dying book say the number one regret is having not lived the life I wanted to live. So if you have a passion for something, please just do it and live your life purpose.
All right, Dr. Tony. Dr. Miller, you're until next Monday.
Well, I'm really pleased to hear from Mr. Roy Walker in terms of being willing to reach out to that younger age group. It's never too late and it's never too early to get started. And and as I've looked around and as I've learned over the years that some of the barriers are barriers that are created either because we don't get started early enough or we don't get started with the proper exposure for our young people. And then they find themselves in a situation that they are not prepared to be able to overcome what is necessary. And some of the behavior problem that we're seeing, as I was talking in this conversation, some of the behavior problem that we're seeing is because that's how people protect themselves. If they can't read, they'll do what they need to do in order to not be embarrassed that they can't read. And so some of it we see in the behavior, I'm not going to read, not necessarily because they're angry, but it's because they can't and they don't want to say I can't. So we need to make certain that, as we are looking and we see things, we're seeing what we're seeing, and we're seeing that a large group of our kids are in this at-risk group. Let's put a barrier to that. Let's stop that problem. Let's make sure we look prior to that, the age group prior to that, and that we begin to invest in that age group so that they don't become a member of that at-risk group, because they're certainly headed that way, and that they're going to continue to go through those things, continue to have same mentors that the a group that were older than they are did, and they're going to see the opportunities in the same way. They're going to learn from those people. They're going to end up there. So I'm just saying, let's get started early and if we can prevent these kids from getting into trouble and help them to learn to find different pathways in life. It's a lot less expensive. How much money does it cost to keep a person in jail? They got to feed them. They got to, these are dollars that if we can invest in a different way, I think that at the end we win. We save. That's my point.
All right. Great point. Dr. Maya, that's Dr. 100. You're until next Monday.
Until next Monday, we heard what we said about the measles. We heard about mpox. We heard about the need to address things specifically in our communities. And those are just two. Oh, and COVID, right? Those are just 3 of the things. Notice that all of them had a component where overlooked and underserved communities fared worse. And the Journal of American, JAMA, Journal of American Medical Association, produced this January an article saying that patients in communities that get care from providers that are from that same community have better outcomes. So I'm excited about CPAS. I'm excited about I Am Able, who has a Black Man in Medicine's Gala coming in March. I'm excited about all the efforts to make resources available to our communities, so that people from our communities can have access to education, come out and have the tools to care for our community in the way the community needs to be cared for. So thank you for making these resources available, and thank you, Roy Walker the third, for joining us today.
Well, just wanted to remind you guys that, as Roy said earlier, the average cost of a credit hour is $147, right?
153. 153. It just
One
got
150. Okay, now it's going up. Is this inflation? I'm just joking.
This is as of April 1st. It is now 153. Sorry about that. April 1st in terms of 153.
Okay, so no, it's okay. It's still cheaper. So it's 153, but the average cost, and this is to answer your question, Dr. Miller. The average cost for a prisoner per day is $120 and about 10 cents. So if you add that up for about a year, you're looking at a little over $44,000 per year. Just wanted to share that. Well, Dr. Mason, you're until next Monday.
Well, first, let me say again, I am really proud of Roy Walker Jr. We go way, way, way back. Back when I had a gym attached, that Roy helped put together a gym attached to my physical office practice, because we understood that exercise was important and as part of a health tool. So he's continued to grow and do the things he's doing over at Malcolm X. And I think that it's wonderful that he's there. We want to also create a little more of an alliance between what we're doing with CPAS and some other stuff with what's happening in some of the city colleges. And lastly, I know that it takes a lot of time, and you put in a lot of hours that are not necessarily, Roy, directly related to what you do, but you do it because it's important. And many of us in many different areas do the same thing. And I just want you to be encouraged that it is working, and it's doing what you need it to do. And whatever the obstacles that you may have to go through, it's worth going over them in order to do the things and keep the kind of opportunities available for our students. Lastly, I'll say that one of the other things that we've had to deal with recently is student support. And it was mentioned about housing. And a lot of people, we have college students that are homeless, and they ride the trains all night. They come into the school early in the morning, use the bath. And I know this because of what we were doing once over at Chicago State. And so there are some things, and we do need to sit down and put our heads together, not just to get students in the programs, but to make sure that they have the wherewithal to be able to successfully complete the programs. And lastly, we need to look back at the current systems and see what kind of things that they can do in some of those things to help out a Malcolm X, or to help out some of the other institutions, so that we can get more of our students in these programs, but more importantly, not only get them in, but get them graduated.
Outstanding. Well, Roy, you're until next Monday.
Well, I just wanted to thank again Nikki and Congressman Danny Davis for this wonderful opportunity of this forum to be able to speak about some of the great things we're doing at the college. And Dr. Miller, you said something earlier around mentorship. That's something that we realize is the hallmark of success for our young Black men. It was because of our mentor program that we started, why we've been able to realize the success that we've had with those who participated in it. And Dr. Mason, you're absolutely right. This is not necessarily a job for me. This is my life's work. being able to give back to the community for a community that has given back to me for quite some time is because of great men like yourself, as well as others here in this panel. That's why I stand here today to try to make sure I support the community the best way I can. And selfishly, one day I'll be in a hospital, and hopefully you all remember that I did this great work so you guys can take care of me and make sure I'm getting the best of care. But no, and all jokes aside, thank you again, Nikki, for this opportunity. And it's a great pleasure being in such a great company of wonderful people.
Well, you will be back, Roy, sooner than you think. Well, Tony, I'm going to need your assistance really quickly because since the congressman is not here tonight, I guess I'm going to be the one to take us home. So let's get ready to travel home. Here's what I want to remind you. Dr. Maya brought up a good point. COVID is not gone. It is still here. So I want to remind you about a few things about COVID. If you are in a room and you don't think you have achieved herd immunity, simply put on a mask. Keep that mask with you in your pocket or your purse and just be able to pull that mask out. If you are in a state where you don't believe that you have reached herd immunity, also one of the most important things is to make sure that we wash our hands. Dr. Tony, if you could do a little simulation of hand washing, it would be great. Usually Maya does that, but her it's kind of fell loose. If you wash your hands properly, remembering to make sure that you get that thumb area and up the side of your arm towards your wrist. Remember to go around those fingernails and under them to remove those bacteria that you may have touched on elevator buttons, doorknobs, or even don't forget the nasty carts in the store when you are in the grocery store pushing those carts. So remember to wash your hands before you touch your face, eyes, mouth. Any of those things, or if you're grabbing chips or something when you're in the car and you're putting them in your mouth, remember to wash those hands. Also remember to keep hand sanitizer on the side, but when you have the opportunity to wash your hands, do not use hand sanitizer in place of water, only if it is not available. Try to wash those hands first. Just want to remind you guys of those things there. And also, if you are sick, don't go anywhere. Keep those germs to yourself. Germs are not love. Do not share the germs if you are sick. If you are ill, simply stay home and let everybody know that you are ill. But let someone know so we can then take care and kind of check on you via phone. We will all drop something off at your door. We will not be coming. We will drop it at your door. I also want to remind you. Oh, sure. Go right ahead, Dr. Miller.
I just wondering, I forgot to remind people I was going to remind. Tomorrow is election day, voting day.
Okay, so let me let you
go out and vote.
Dr. Miller. Let me let you in. Let me let you in with that. I'm gonna let you in with that.
Yeah, it's important.
Nobody can actually try to find the congressman by saying we had a political conversation during this time. So wait, I'm gonna let you in with that.
It's important that people exercise their right to vote. If you don't voice your choice, you lose your choice. So voice your choice. Go out and vote. For the person that is helping you, the person that is carrying the mantle for you, and whoever your choice is, go and vote. Don't stay home. Don't waste your vote. It does no good to waste it. It's just like anything else that has a worth to it. If you waste it, it's sort of like almost committing a crime. Go vote.
It is committing a crime because people lost their lives for us to have the right to do what I will be doing tomorrow. So you are absolutely right. I also want to remind you about the measles and the measles vaccine and make sure that it's available for you. And then don't forget RSV is still here and the flu. The flu is still here, so know that there are flu vaccines readily available. And please, 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 we have gotten some data knowing that this is working. But remember, let's not use our emergency rooms as our office visits to see our doctors. I want you to get your primary care physician. It's Monday night, Couch Conversations. Meet us next Monday. Good night.